Thank you, Dr. Arias and Dr. Kanata, for the invitation. Hemodynamics is the core of the venous pathophysiology. Despite its pivotal relevance, venous hemodynamics is absent in most meetings and articles. Maybe because too physical for doctors, so maybe doctors should learn more about fluid hemodynamics and physicists should learn more about medicine. In fact, technological innovation in phlebology as foam, glue, laser, radiofrequency TREVEX are not scientific progress, but only tools to ease ready-made destructive treatments based on old erroneous pathophysiological concepts. Actually, hemodynamics and clinical studies show that varicose veins are not the cause but the symptoms of the venous insufficiency. Ablating veins is cause of recurrence. Ablation, recurrence. Treating the hemodynamic disorders treats the symptoms and collapses the varicose veins to normal. In this example of CHIVA, veno-venous shunt disconnection without any venous ablation, you can see here this big, huge varicose vein, totally collapsed, still draining, but no more dilated, without any ablation. A proper knowledge of venous hemodynamics is mandatory to improve the diagnosis and treatment of the venous insufficiency. CHIVA is a tailored hemodynamic and conservative treatment of the venous insufficiency, with here the mapping, the strategy with 2 disconnections under local anesthesia, and the result here, collapse of the varicose vein without any ablation. Venous hemodynamics is better understood today thanks to duplex ultrasounds born 40 years ago. In 12 minutes conference, we cannot teach but just address the basics of the venous hemodynamics, their validation by evidence prevalence of CHIVA and the destructive methods. The venous system is made up of pumps, vessels, and fluids that obey the laws of hemodynamics. Right heart pump, thoraco-abdominal pump, valvo-muscular pump, veins, and venous capillaries. The basic concepts of venous hemodynamics are the crucial transvenous pressure, residual pressure, venous-venous shunt, and dynamic fractioning of the gravitational hydrostatic pressure. Whatever its symptoms and signs, as edema, varices, skin damages, ulcer, venous insufficiency is due to excessive venous transvenous pressure, whatever it is, edema, varicose vein, or ulcer or varicose veins. Transvenous pressure is the key parameter of the venous hemodynamics for drainage of the interstitial fluid of the tissues into the capillaries, venous caliber and venous bed volume, as well as right heart preload, which is the true reservoir effect of the venous system. The cause of the venous disease are various: congenital, genetic, biologic, venous hypertension, posture, iatrogenic, as for example, destruction of varicose veins. They cause venous hemodynamic changes as obstacle to drainage that increases the residual pressure, valve incompetence that impairs the dynamic fractioning of the gravitational hydrostatic pressure, and venovenous shunts that cause the diastolic volume pressure overload by the valvomuscular pump. These changes cause an excess of transmitted pressure, which is responsible for edema, skin changes, ulcer due to drainage impairment, and varicose veins due to veins dilation. Varicocentric treatment is to say destruction and ablation of varicose veins, doesn't respect the drainage, makes tissue suffering, triggers vicarious recurrence, and this destroys eventual great saphenous vein bypass. Hemodynamic centric treatment lowers the transmural pressure because compression increases the extravenous pressure, posture and obstacles liberation or bypassing lower the intravenous pressure, and CHIVA fractions the hydrostatic pressure, disconnects the shunts, eases the tissue drainage, spares the great saphenous vein, and reduces the recurrence. CHIVA strategic principles are venous shunt disconnection, venous blood color fractioning, open vicarious shunts respects, reentry perforator spare, no veins ablation except non-draining R3 and R4 veins, and saphenous vein sparing. CHIVA literature is 127 articles on CHIVA treatment and 9 books and some chapters in other books. Biomechanics validation. The relevance of Wall's stress for venous remodeling process as the CHIVA techniques limits venous reflux, hence feeling pressure, lowers transmural pressure in vein connected to the bypass vein, which in turn lowers their wall stress. Clinical validation, Cochrane review. The CHIVA method reduces recurrence of varicose veins and produces fewer side effects than vein stripping. Long-term efficacy of different procedures for treatment of varicose veins. CHIVA, best results and less recurrence. The informed consent raises an ethical and professional issue. Most of the time, no information is given to the patient about benignity of the varicose veins, and possible future vital necessity of his great saphenous vein, even if incompetent as arterial bypass. Thank you for your attention. Refer to literature for better understanding.